David Miliband, thank you so much for taking time to speak to The National. We meet at a time that there's incredible concerns about the situation in Gaza and famine becoming a reality. IRC has just issued a statement and a warning about that. Give us a situation update on Gaza and how can the situation be improved?
Yeah, the situation in Gaza is beyond grave. The International Rescue Committee is one of a number of NGOs working on the ground there. We have specialism in the treatment of malnutrition, in addressing child protection issues, in supporting water and sanitation. And the months of war, of intense conflict, have created a situation that is beyond grave. I would describe the current situation, especially in northern Gaza, as catastrophic, because there simply isn't enough aid reaching Gaza, and the aid that does reach isn't reaching the people in the greatest need. And so the heartbreaking stories are not just of people under threat from the fighting, they're also under threat from simple lack of food and water to allow them to survive. And in these conditions, there's not just the threat of famine, but also the associated diseases that go with this catastrophic situation in respect of the water and health system, which has been so destroyed. I think it's also important to say that the agency that issues the famine warning are not given to loose talk. The international phase classification system is, if you like, quite small c conservative. It doesn't throw the word famine around easily. There are 5 grades of food insecurity. And so for this warning that famine is effectively here, that we have days, not weeks, should be seen in the context of a quite careful international body, but also the international evidence that when famine is declared, there are often people already dying. And so our humanitarian appeal, not a political appeal, but a humanitarian appeal based on the work that we do in Gaza as well as around the world, is for remediation at 2 levels. One is just the flow of food and water, because actually there are crossing points. There are ways of getting food, and not just measured by the number of trucks, which in all sorts of ways is not an adequate measure. But we do know that if you use that measure, October was a terrible month. Only 37 to 40 trucks per day getting in. In November, that's gone up to more than 50, but still compared to 500 trucks a day before October the 7th, 2023, you can see how you end up in the kind of catastrophic situation that exists today.
And the catastrophic situation is a man-made one. I mean, some of the frustration for people on the ground, the NGOs working on the ground, the healthcare workers, is this can be remedied immediately. As you said, days are left before you can really try to stop a famine taking hold. And yet, this is a political decision, even though you are humanitarian agencies. What can be done?
Yeah, I think it's important to say that the feelings of our aid workers are way beyond frustration. Frustration might be something that you or I suffer in a traffic jam. I mean, this is way beyond frustration, because the death and destruction that we're seeing produces emotions way beyond just simple frustration. The remediation needs to happen at 2 levels. One is just the severely practical, where hours count, and that is about aid flows, the opening of crossings, the end of this alleged dual use issue that is interfering with what goes into trucks and trucks being turned around. But then the second level is we have been arguing for a sustained ceasefire, a permanent ceasefire, an immediate ceasefire for a very long time now. The United Nations Security Council has been calling for a ceasefire for a very long time. Now, as you know, this is intensely linked to the negotiations around hostages. What we say is that the humanitarian effort, the first remediation, shouldn't be held hostage to this, that it's vital that the hostage issue is addressed, but the humanitarian issue needs to be addressed in and of itself.
And that takes us also to Lebanon, to your point about ceasefire. There's also calls for ceasefire because the suffering in Lebanon it's very difficult to even try to compare situations. Suffering in Lebanon is actually also quite significant, especially when it comes to displacement. Now, the Lebanese government is still able, and NGOs and humanitarian organizations like IRC are still able to do aid delivery. But displacement is a big concern. And also, this looks like this is not going to be a short-term problem.
I think it's very important that we never end up normalizing what's happening in Gaza and what is now happening in Lebanon. I mean, the Gaza population has been displaced many times, but the figures in Lebanon are also very, very striking. 1/4 of the population, 1 million people, have moved in the space of 6 weeks, been forced to move in the space of 6 weeks. The UNHCR, the High Commission on Refugees, reports that 300,000, 400,000, 500,000 people have moved into Syria. I mean, that's a very big change. Some of them Syrians, some of them Lebanese. This is a tumult of a very significant kind. And obviously, the displacement is just the tip of the iceberg, if you like. Lives are being turned upside down, literally. And that affects our own staff as well as the clients who we have. The International Rescue Committee has been in Lebanon helping Syrian refugees and the Lebanese host population now for 12 years. But we know from the stories of our own staff members that they've had to move, that they're concerned about their own welfare and their own situation, because obviously the death toll is rising as well. It's in the thousands, which is very, very high. The displacement is over 1 million now. And so we're sustaining services at a time when it's not just our clients who are under threat, but it's our own staff as well. And we're expanding our services in Mount Lebanon, which is important. We're expanding our services in northern Beirut. We're expanding our services in the north of the country are being sustained. Those are health services. Mobile health is something that we do. Child protection is something that we work on. We've not previously done the health work in Lebanon. We've been more focused on education and livelihoods issues. Livelihoods, very, very significant. That means how people sustain jobs and incomes at this time, because obviously for the host population, that's been the economic crunch has been a massive issue over the last few years. So we're appealing to our donors not just to increase their funds, but to give us flexibility so that we can address the needs that are emerging from this very acute situation. I think it's important to say in the Lebanon situation that if one reads the runes of the diplomats, there's a feeling that the ceasefire in Lebanon is a more imminent prospect, a more present prospect than that in Gaza. And obviously we want that as soon as possible.
But to your point about ceasefires and what the diplomats say, as former foreign secretary, you understand the political machinations around this. But international humanitarian law and international law should not be violated. And here, frankly, talking about Israel and repeated violations, despite what the UN is saying or international organizations. So what tools are at your disposal, both in your position as president of IRC, but also importantly, that diplomats and officials should be pushing for in terms of respect for norms and laws?
Well, you're making a very, very important point. International humanitarian law is not biased between different parties. It's not conditional at all. It's very, very clear that the right for civilians not to be targeted, the right for civilians to receive aid, those are absolute. Now, the requirement is imposed not just on states who sign Geneva Conventions. It's also, as a result of decades of development, it's imposed on non-state actors as well. And so it's important to say that states and non-state actors have that responsibility. As humanitarians, we are not prosecutors, we're not a legal authority, but we are on the receiving end. And what we can say without any fear of contradiction is that the clients that we serve are not having their rights sustained. Those rights to aid, those rights to life and limb are not being sustained in the current conflicts. And that's something that is incumbent on all parties to the conflict. We always appeal to all parties to the conflict, not as a kind of routine knee-jerk, not as a piece of diplomacy, but because it's true. It's important. And I think that the point that you're making is one that raises very profound global issues, because the abuse of international humanitarian law is not only a Middle East question, it's a Sudan question, it's a wider question. And at the International Rescue Committee, we've been pointing out for some time the guardrails that are established by international humanitarian law are being undermined. We can only appeal for accountability to be meaningful, and for the protection of those norms to be upheld by the powers that be. We're on the receiving end rather than on the other end.
You mentioned Sudan because I want to come to Sudan. Incredible scale of suffering in Sudan, but also a key point is this ability to deliver aid, and it is being used as a tool by warring sides in not allowing aid to go to vast parts of the country. What are you doing in Sudan? Also, what can be done in Sudan?
Well, this issue of the flow of aid that we were talking about in Gaza is not only a Gaza issue. So your point about Sudan is very, very important. We've been in Sudan for some time. We also have operations, humanitarian operations in South Sudan and in Chad, so to the south and to the west, where refugees have flown. We also are working inside Sudan itself. And I think that we mustn't fall into the trap of thinking that numbers are everything, but numbers matter. For the benefit of your viewers and readers, 26 million people in Sudan in humanitarian need. That means they need NGOs to support them in order to survive. 11 million people now displaced inside the country. Khartoum, a capital city of 6 million people, effectively zeroed out. People fleeing, including our own country director, our own head office had to move. 1.5 million people, refugees in very poor countries. Next door, what are we doing, you asked us. We are trying to keep people alive through our health and nutrition services. We're trying to help people purchase in markets that still exist. We're trying to sustain children who are suffering enormous trauma. Now, you're also right, those aid flows are being interfered with on all sides. And that's something where we can speak to the dire consequences for the population in Sudan. 2 million people trapped in Darfur who are facing famine-like conditions again. Remember, famine is becoming something that is also in danger of being normalized. It's not that there isn't enough food in the world, but as you pointed to, it's political will to actually get the food to the people who need it. And I think this is a really fundamental challenge to regional powers as well as to global powers.
Again, this bigger conversation about norms and international law, an idea that famine before used as a weapon of war would be seen as completely unacceptable. You'd feel the world was up in arms. And yet, and you're right to call me out earlier on the word frustration, that it seems so mediocre compared to the scale of suffering. But there is, and for, again, our viewers, but also, for general audiences, there's a frustration and a resentment towards an international order that allows this to continue and be seen in real time and live. Terrible things have happened in different parts of the world, Rwanda, and many other cases, former Yugoslavia and so forth. But the fact that people are seeing it and yet feel that there is very little they can do, to try to channel that in a way that can affect change at a time when, again, we're seeing norms related to asylum seekers and refugees, another important portfolio for you, suddenly becoming actually more resented and not given the space. How do you deal in a climate like that?
Well, you're making a really important point, and I would say two things in reply that speak directly to this region. The two things are as follows. First of all, this global order is not the same as the global order of 20 years ago, never mind 40 years ago. The new global order is one in which countries like this in the region, they have a lot of power in this system. Maybe not a superpower like the US, or maybe China is an emerging superpower. The US is still a quarter of global GDP, of global income. But in terms of political power, it's a multi-aligned world, not a unipolar world. And I think it's right that people in this region call out the West and say, let's see you fulfill your responsibilities, let's see you match action with rhetoric. But it's also important to recognize that this is not a Western-run system anymore. There's a new global distribution of political power in which a whole range of states have a lot of influence. Sometimes it's called a multipolar order. I don't actually use that phrase. I use the phrase multi-aligned world to speak to the fact that there are different alliances on different issues. That's the first point. The second point is we're living in a world where nations are coming together to do things in multiple coalitions. And if you think about the Sudan issue, if we wait for the global system to come and turn its attention to Sudan, I think we're going to be waiting for a very, very long time. There are regional and local power brokers who are very, very important in North Africa. And I think it's very, very important that we all take our responsibilities very, very seriously, because it's civilians who are on the wrong end of this abuse that's happening, this impunity that's taking place. And I think it's a time when no one should be able to dodge their responsibilities, whether they're in government, whether they're in the private sector, whether they're in foundations, or whether they're in NGOs.
Yemen. We haven't spoken about Yemen. Yemen is one of those countries that sadly is not getting the attention it deserves, be it the striking of Hodeidah, be it recently the inability to deliver aid. How do you see the prognosis when it comes to Yemen, and also what more can be done there?
Well, Yemen's a very, very important example of a more global issue. What happens when humanitarian need is not properly addressed? How does that lead to radicalization? How does it lead to a change in local circumstances, and what kind of regional implications can that have? When I was here, certainly 4 years ago, and maybe even 2 years ago, Yemen was, the trauma and the tragedy of Yemen was a Yemeni issue. Now it's become a regional issue. And its significance, given the acute geographical position that it holds, has suddenly taken on greater resonance. And one of the things that we always say at the International Rescue Committee is so-called civil conflict rarely stays within the country that it's taking place. One obvious element of that is refugee flows, but there's also potential geopolitical destabilization that takes place. My job, though, we have a team in Yemen, both in the north and in the south, is to say that the needs of the Yemeni people remain unmet. They remain unmet for complex and complicated reasons. It's not on the front lines in the way that Sudan or Gaza or Lebanon now are. In our list of top 20 countries, our emergency watch list, Yemen hasn't disappeared, but it's going down, not especially because the situation in Yemen is that much better, but because the situation elsewhere is that much worse. And so I think that the appeal I would make is that amidst the geopolitics of Yemen, let's not forget the local politics, which is at the root of quite a lot of the trouble.
You mentioned, of course, refugees from Yemen and kind of the displacement that's happening, and the wider issue, as you said, there's the agency of countries in this part of the world, but at the end of the day, it still feels very much like the tone that's set from the US affects major portfolios, including that of how you deal with refugees and asylum seekers. So I wanted to ask you about the incoming US president, Donald Trump, has very strong views on refugees and asylum seekers. And in Europe, we're seeing a real change in a number of countries when it comes to refugees and asylum seekers, where millions of people traditionally have benefited from asylum and refugee status. How concerned are you about this change of tone? And what would be your appeal to those countries?
Well, it's very good that you use the word appeal? What's my appeal to European or now the new American administration? I mean, it's simply stated, my appeal is to live up to the legal and moral commitments that they've made. And just to explain the legal commitment, sadly, Gulf countries are not signatories to the Refugee Convention, which guarantees rights for refugees. I would appeal to Gulf countries to sign up to the UN Refugee Convention. But the United States is a signatory to the Refugee Convention, and what it says above all is that you shouldn't send people back to danger. You shouldn't send people back where it's not safe. And I've recently visited the Mexico-Guatemala border. I met people from Venezuela who are political dissidents from Venezuela. They don't want to be sent back to Venezuela. I met a man from Cameroon who we were serving. He'd been targeted there because of his ethnic group. My appeal to President Trump, my appeal to European leaders, is to live up to the legal and moral commitments that they have made and to put in place the practical systems that allow those legal and moral commitments to be upheld. Let me just give you a very simple example. A lot of Americans are very frustrated that there's still 1 million asylum seekers whose cases have not been heard. I want those cases to be heard, but that takes investment in the systems to get them addressed. And I think that is manageable, that is doable. The refugee issue is manageable if you decide to manage it. And our appeal to the new administration would be, let's manage this issue effectively, because it is manageable. You have your responsibilities, countries in Latin America have their responsibilities too, other countries have their responsibilities, because it's easy to throw up one's hands and say that it's not a manageable issue. I don't think that's right. I think that the choice in the modern world is not whether people move or not, it's whether they move in legal, safe, orderly fashion or in undocumented, illegal, unsafe and disorderly fashion, and that's a global challenge.
Dr. Anwar Gargash, advisor to the UAE president, gave a speech recently speaking about the humanitarian cost of political actions, saying we cannot continue to accept that this is just fallout from political actions. How important is it to start putting humanitarianism into political decision making?
Dr. Gargash's speech was a really very important contribution, leadership contribution, to the debate, but also the action that we need to address this ballooning humanitarian crisis, not just in this region, but around the world. The humanitarian imperative, the need to address humanitarian plight, is something that is not just a real requirement here in Gaza, in Lebanon, in Yemen, but also around the world, whether in Sudan or further afield. Now, the humanitarian imperative is not being met in the modern world, and that is what I think is the significance of Dr. Gargash's speech. He called on all of us to work in a different way, to recognize that, and I think I quote him rightly, humanitarian loss cannot just be collateral damage from political decisions. It must come before political decisions, and it must enter political calculations. We at the International Rescue Committee call ourselves a solutions NGO. And I think the significance of what Dr. Gargash said was that he wasn't just offering analysis of what's going wrong, he was trying to chart a way to go forward that provides answers. This kind of leadership is desperately needed in the modern world because we're seeing a retreat from humanitarian principles, not the advance of humanitarian principles. In a way, the retreat from humanitarian principles has been running through all of our discussion today. And the dialogue that Dr. Gargash is calling for seems to me absolutely essential if we're to get to the roots of the problems, not just deal with the symptoms.
And so the UAE's leadership at this moment in trying to think about humanitarianism at the heart of it, as you said, is important at this time in history. What would you want to say to UAE leadership and UAE practitioners in trying to further those principles?
I think the significance of what Dr. Gargash is saying, what the UAE is saying, comes from the fact that these are not just words. This country has the ability to match actions with resources alongside the words and has a proven track record of being interested in high impact, cost effective interventions that don't just treat symptoms but address root causes. In our NGO, we are responsible for 30% of all of the impact evaluations around the world. We want to know that every dollar that goes into the International Rescue Committee has greatest impact. We've also done 400 cost effectiveness and cost efficiency studies because we want to make sure that the humanitarian techniques that we use are able to make the dollar go further. Now, the significance of Dr. Gargash's speech is that he's not just committing to that kind of impactful humanitarian action. He's also saying the politicians need to address humanitarian consequences before they take political decisions. I always say every humanitarian emergency is also a political emergency. And that seems to me to be in line with what Dr. Gargash is saying.
Thank you very much for your time.
Thank you
Very
for
good
yours.
speaking with you.
Thank you.